I'm not a medical doctor, but I am associated with the design and building of a mobile tele-oncology unit for the rural areas of Kerala. I take this opportunity to introduce the mobile telemedicine unit, that is mobile tele-oncology unit, Sanjeevani, and share our experience in using this unit for cancer detection and treatment of initial stage cervical cancer in the rural areas of Kerala over the past 6 months. Before I introduce Sanjeevani, let us explore the need for such sort of a unit. Let me quote Dr. Rajiv Sarin, Director of Tata Memorial Hospital, Mumbai. He gave the statistics in CABAG in Washington in March 2009. That is, 1 million cancer cases are detected annually throughout the world. And by 2020, the number of cancer cases will be 2 million. And more alarming thing is, the cancer burden is shifting from the developed world to the developing world. In India, 1.5 lakhs of cervical cancer cases are detected annually. Out of that, 1.2 lakhs ladies die because most of them seek medical attention only in the late stages. At that time, only palliative care can be given. No effective treatment can be given because by the time secondaries would have come up either in the breast or brain or other organ. So this is the alarming situation. And cervical cancer is one of the most curable cancer, most understood cancer. And if this can be nipped in the bud, many of our mothers and sisters can be saved from premature tragic death. So this is the background. This mobile unit was conceived and developed by CDAC Trivandrum. This project was sponsored and funded by Department of Information Technology, Government of India. The objectives of this project are early cancer detection, follow-up consultation, and treatment of early stages cervical cancer at patient's location. Because this is at patient's location, this is very important because 70% of our population stay in the villages and they do not have the resources either to go and seek medical attention at far-off places. And moreover, many of these cancer cases are not detected in the early stages. They are asymptomatic. This is the first mobile tele-oncology unit in India with the treatment facilities. There have been many units with the diagnostic facilities, but as Mr. Nene told day before yesterday, that there is no point in going and telling a rural lady or a person that he is having cancer and but we are not in a position to do anything about it. That will kill his peace also. But we should be able to do something. If when we detect a problem, we should be in a position to offer a cure also. So this is a unit with a treatment facility. Then the field deployment is done by Malabar Cancer Care Society, Cancer Care Society Kannur, who is an NGO, and they are in the field for the past 20 years. They are also a nodal center of Regional Cancer Center, Trivandrum. Sanjeevani Tele-Oncology Unit consists of a 11 meters long, fully air-conditioned vehicle fitted with advanced medical and diagnostic equipments, telemedicine infrastructure, connectivity infrastructure, telemedicine software, generator, UPS, water tanks, public address system, laptop, projector, etc. The supporting hospital to Sanjeevani is Regional Cancer Center Trivandrum at present, but in future, all the medical colleges of Kerala will be enlisted. The medical equipments in Sanjeevani are mobile X-ray unit, computer radiography unit, ultrasound scanner, video colposcope, cryosurgery unit, digital microscope, digital ECG, biochemistry analyzer, hematology analyzer, gynecological surgical table, glucometer. The telemedicine infrastructure is video conferencing system with LCD TV, telemedicine workstation, then telemedicine software, Tejas, LCD projector and projection screen. This is for this CME activities for creating awareness about this cancer to the local population. And what are the preventive actions that can be taken. This will be imparted to the local populace. Then satellite connectivity equipments like a SkyIP modem, LNB unit, antenna control unit, interface to the medical equipments. Electrical system in Sanjeevani consists of a UPS, 6 kV UPS, LPG generator, LPG tank with a 50-liter capacity, facility for drawing external power, air conditioner. Usually Sanjeevani operates from local grid power. It takes around 18 amperes at 220 volts. And if it's not available, an LPG generator which is built into that can be used for generating 14 kilowatt power. And a separate LPG tank is also provided, and it is absolutely noiseless, vibration-free, and smoke-free. The connectivity is provided by ISRO VSAT. It is having a 384 kbps bandwidth, and it provides excellent video conferencing facility. This is the communication architecture. Then Tejas telemedicine software is there. It's a web-based. It's also developed by CDAC Trivandrum, web-based centralized telemedicine software with the local storage of patient data, electronic medical record. Then annotation facilities are there at both ends, so that the doctor in the doctor in Sanjeevani as well as doctor in Regional Cancer Center can annotate and share the information. Then fixing appointments with the expert doctors can be done. Patient-doctor interaction through audio, video, and text communication. Application upgradable with the specialty modules. Then e-health card interface is there for those cases which needs a follow-up. Say, for example, a lady detected with this precancerous lesion of the cervix, given treatment. Then, of course, that lady has to be followed up for any recurrence of the disease over the past, over the next 3 months, and after that, once in 6 months. So this is the e-health card, which is a smart card, which will be having which is having a 4 kilobyte memory, and all the patient disease summary and treatment summary are given in the smart card itself. And when it is put on the reader, all those will be displayed. And if the doctor wants to have a detailed information on the course of the disease and treatment, then he can very well click on the link, and the whole EMR will be displayed. Sanjeevani is aimed to extend the reach of Onconet Kerala to the 5 northern districts of Kerala. Onconet is a network of 5 early cancer detection centers with the Regional Cancer Center Trivandrum. This was also implemented by CDAC Trivandrum. It was a tremendous success, and seeing its success, this was replicated at Adyar Cancer Institute, Tamil Nadu, connecting 7 early cancer detection centers, including Bhimavaram and Andaman Nicobar Islands to Adyar Cancer Institute. There also it was found to be a tremendous success, and now Government of India is implementing it in throughout India, in all regional cancer centers through NIC. Sanjeevani was handed over to Malabar Cancer Care Society for the field deployment, and Sanjeevani is functional from January 3, 2010. Now I shall show you some snaps of Sanjeevani. This is the video conferencing room of Sanjeevani with the one LCD TV and one LCD monitor for accessing the patient medical records. And it has got communication equipments to the right-hand top corner. This is the laboratory, which is having a hematology analyzer, biochemistry analyzer, centrifuge, and a small sterilizer. Also, it houses the digital microscope. This is the surgery room of Sanjeevani, where the ladies detected with the first stage cervical, precancerous lesions can be given cryotherapy. Recently, one LEAP surgery was also conducted. This was purposefully done just to find out whether this Sanjeevani is suitable for that. And a high-grade lesion was removed in a 34-year-old lady in this mobile unit. And that was also in a remote area. So this shows that people, even with advanced cancerous lesions, can get a treatment at their locality with the help of such a mobile unit. This is the digital video colposcope for those cases, confusing, cases presenting themselves with the confusing symptoms. The doctors in the Sanjeevani may not be able to take a spot decision. So the image of the cervix or videos of the cervix can be taken and transmitted over the VSAT communication to Regional Cancer Center, and there the process of this community oncology or other head and neck, etc., they will